This podcast is produced by Outcomes Rocket, your healthcare exclusive digital marketing agency. Outcomes Rocket exists to help healthcare organizations like yours to maximize their impact and accelerate growth. Visit outcomesrocket.com or text us at 312-224-9945.
Welcome to Expanding Access, a podcast by Behavioral Health Tech, where we explore the cutting edge of mental health, substance use, and autism and IDD care. Each episode features insightful conversations with industry leaders who are driving real change through technology and innovation. Whether you're a provider, payer, or just passionate about expanding access to behavioral health care, you won't want to miss these stories. Let's dive in.
Hey everyone, welcome back to another episode of Expanding Access, recorded live here at the Behavioral Health Tech Conference. Today, I have the privilege of being with two amazing guests. First, I want to introduce you to Luis Suarez. He is the CEO of Sanarai. I also want to introduce you to Stella Tran. She's the Senior Program Investment Officer of California Healthcare Foundation. I'm excited for our conversation today. Welcome to you both.
Thank you. It's great to be here.
Thanks for having us.
It's a pleasure. So to kick things off, well, actually, to begin with, what brings you guys to the conference?
So I'm with the California Healthcare Foundation, where our mission is to improve access and quality of care for Californians with low incomes, and behavioral health is a huge portion of that. And so wanted to be here to meet the community and I think share ideas and innovations like Sanarai.
I love it.
Yeah.
I love it. Thanks, Stella. Luis, what brings you here?
So at Sanarai, we're building a mental health platform for Spanish speakers. And so we connect the Latino community and specifically Spanish speakers through a network of mental health providers across the US, Mexico, and Argentina to provide subclinical care in Spanish and in a culturally relevant way. We've met people in behavioral health tech at the conference, so it just made a lot of sense to be here and to a lot of people that I'm meeting in person for the first time and just network and see what else is out there and how can we find partnerships and building, access and value together.
That's great. This is the place to be. If you want mental health, behavioral health, this is the place to be. What I'm hearing from you guys.
We also love Salome and the team.
Oh, yeah, they're fantastic.
Yeah.
Shout out to Salome and the team.
Yeah.
You guys are doing amazing work. Okay, so let's dive in. Tell us a little bit about yourselves and your experience.
So I can start. So I'm originally from Mexico City.
Awesome.
Came to the US to do my MBA, then worked in management consulting for 3 years after I graduated. And in 2020, I was looking for mental health services like other times in life. And I realized that it was hard to find someone that I could speak Spanish with and that I could fit in my schedule. So that's when I realized that there is a huge gap to cover the Latino community's needs in terms of mental health. Started doing more research and then decided to go for it and
That's awesome.
pursue entrepreneurship. And yeah, that's how I got started.
Congratulations. And sounds like it started with a personal need that you saw. Wow, there's a huge gap.
Exactly.
And now you're here.
Exactly. That's how I get
I love it. I
to the
love it.
space.
Thanks for sharing that. That's awesome. Stella?
My story is also deeply personal. So I'm first generation Vietnamese American. And growing up, I really got to see my family and my community around me rebuild their lives after the Vietnam War and then try to access this really difficult healthcare system as immigrants. And so Medi-Cal, which is California's Medicaid program, is a huge lifeline for them. But they also needed culturally competent, culturally informed doctors that could understand sort of that trauma without, talking about the trauma. No one, the PTSD was real, but you couldn't actually address it.
Yeah.
And so having doctors like that were so critical into actually improving care. But the number of doctors that are able to provide that care there's not enough to actually fulfill the need. And so I think you really need innovation to fill a gap. Again, just like Sanarai, bringing sort of new supply and new energy into the system.
Love it. Yeah. Thanks for sharing that. And those partnerships are super important.
Yeah.
Yeah.
Totally.
Well, very, very interesting. And I think there's opportunities here for us all to collaborate and learn from the experience that you guys have working together. So how are you helping expand access to mental health?
At the California Healthcare Foundation, I work on a team called the Innovation Fund. The foundation is big, and I have colleagues that are out there doing grant making, thinking about, how do we illuminate new care models, build up the behavioral health workforce? How do we inform policymakers of what's happening on the ground so we can actually get the resources that we need? Or even how do we actually engage with Spanish-speaking doctors outside of the US because the need is so great? But on my team, the Innovation Fund, we're really thinking about innovation as a lever and how do we support emerging startups, invest in them, and help them access the Medicaid population so that we can improve access. So Sanarai is one of our portfolio companies, and really thinking about how do we, again, use innovation as a critical lever to improve access and quality of care.
Love that.
Yeah.
Yeah, and it's been such a pleasure working with CHCF and the team, and just that alignment in mission is big. So I talked about that gap, just to quantify that. So there's only 5% of mental health providers in the US that can administer their services in Spanish versus 13% of the population that speaks Spanish at home. And the treatment rates for Spanish-speaking communities are way below the average. And in the context of a mental health crisis with booming demand for services and a shortage of providers in the first place, those numbers just make it 3 times as hard to get behavioral health services in Spanish. So what we're doing by opening that new network of providers that focus on subclinical care, so more in line with coaching, we're allowing the folks that are super overwhelmed, the licensed therapists in the States, the psychiatrists work at the top of their license with folks that need more acute care or have more clinical needs. So then in that way, we kind of alleviate part of the huge supply crunch that we have.
Yeah, critical work. And it's really great to see partnerships like yours address the needs of communities that are very specific, whether it be language or cultural, like the one you mentioned with your family. It's critical to see these. Building trust is key, right? And it's at the center of the work you guys are up to. Luis, tell us about building trust. How is it related to expanding access and specifically this significant stigma around accessing mental health? Can you talk to your approach and Sanarai's approach to building that trust?
Yeah, so it has been something, a centerpiece of the whole idea of building this company from the ground up. And I think an important part is the authenticity of just being company that started with this purpose to serve these clients. So the services are in Spanish, right? The website is not a translation of something else.
Yeah.
It was meant to be
so important.
Yeah, Spanish from day one. And the providers that we have, are culturally similar to our end users. So that also helps building that trust and just people, when they start with their provider, they have a common baseline of understanding. And then that, we believe, leads to better outcomes. And then, for folks to continue and longer with engaging with our providers. And then something that we also think a lot about is the level of customer service that we want to provide. So even that we're, affordable service, we want to give that really good customer service that sometimes in healthcare, generally you don't get. So meeting our clients where they are too, for example, we use tools that Spanish speakers use a lot, like WhatsApp and Zoom, that people know and and we don't have to reinvent the wheel to just, provide services and meet people where they are. And then lastly, it's the last piece is educating to overcome that stigma. So we have a podcast in which we have our providers as guests.
Oh, that's awesome.
So they talk about their experiences. They talk about, just common things that, people are thinking about and want to learn about. And just it's, content that will be helpful to overcome things, daily things in life, or at least to get more educated and more interested in getting services eventually.
That's great.
I love the podcast too, because I feel to have good therapy, you have to date around and find the right therapist, and to be able to engage with your providers and know, maybe we are aligned and they're sort of seeing the world the same way I can. I think just sort of opens the door on and removes the barrier, you don't have to call 5 or 6 people to figure out who your person is. Yeah.
Yeah, you get that initial exposure and that initial, this is what it's going to look like, kind of idea of what the service is. And So you take people that might not be there, like in terms of having services before or understanding too much to, closer to, because it is a step that you have to take, right, to reach out for help.
They're able to try on the shoes, so to speak.
Yeah, totally.
I love it.
Yeah.
I love it. Very innovative. And so, this is the Spanish community, but obviously, the fund, the CHCF, looks at a lot of different communities. So how are you, Stella, and the team looking at your partnership with Sanarai and Luis and modeling after that to create trust?
That is a great question. And I think really important as the foundation is exploring our early work in AI. So the big sort of problem or thesis is thinking about how we ensure that the safety net institutions that serve Medicaid patients have access to the AI technologies that our academic medical centers have access to, and not create further disparities because the Stanfords of the world have it, but our community clinics don't. But that requires a lot of patient trust to be able to bring them on along to the journey. And so I think we did a survey last year where we found that a little bit over 50% of Californians are feeling like not very great about AI. They don't trust, they don't know if they want AI in their care. And so I think it's really important that we think about how do we build that trust. And I think there's so many things that we can learn from Sanarai's approach. I mean, one is how do we create, as we think about patient consent and informing them what they're actually signing up for with AI, how do we make sure that's culturally competent and really respond to some of the concerns and fears that they have? How do we maybe let them test, in the podcast today, test and understand it before they actually sign up for it? How do we co-build with our communities if possible? And I think to the extent that we can provide education on the benefits, like in ambient scribing, that the provider can actually be more present now because something is listening in the background versus them sort of talking to you, going into the EHR, talking to you back and forth. And so creating this new improved patient experience and just less burnt out providers. So how do you share that full story as well as things that we care about, language access that AI can translate so much better. And I think also potentially create new models of support and care. So I think we're trying to learn as much as we can from the community around us, but definitely Sanarai's approach has been a really helpful case study.
That's really great. I appreciate you sharing that, and at the conference, this theme of collaboration, we could get so much further with collaboration. And Stella, Luis, your organizations are a great example of how collaboration could move the needle on expanding access. So thank you for the work that you do. As we look to our audience who couldn't be here with us today, what would you leave them with? What call to action would you leave them with? What do you want them to be thinking about? And where can they reach out to you to learn more?
Well, thank you so much for this conversation. It was really great to share more about CHCF and Sanarai. We have a really great website, so I just highly recommend if any of these topics were of interest to check out chcf.org. And if you want to hear more about Luis's story, we have a podcast called Making Waves in Health Tech, where it actually goes deeper into the background and the platform, and would love our listeners here today to check it out.
Awesome. Thank you for that.
Thank you.
Luis?
Yeah, definitely. Our podcast is a good place to start if you speak Spanish. The podcast that Stella mentioned on TF, that it's also deeper conversation in what we do and our plans. And check us out. We're at sanarai.com. And looking forward to continue expanding access and getting closer to our mission.
Outstanding. Well, thank you both for the insightful conversation today. For everybody tuning in, just thank you all for tuning in. And while you're not here, you still have the opportunity to take action and form partnerships like the one we shared today with Luis Suarez, CEO of Sanarai, and Stella Tran, Senior Program Investment Officer at the California Healthcare Foundation. In the show notes, you'll find all the ways to get in touch with them. So make sure you do take action on it. And Stella, Luis, thank you guys so much for being with us.
Thank you.
Thanks for
so
having
much.
us.
Thanks for tuning in to Expanding Access. We hope you're feeling inspired by today's discussion. If you've enjoyed the episode, subscribe and share it with your network. For more content and opportunities to get involved in transforming care, visit behavioralhealthtech.com. Until next time, let's keep pushing boundaries and expanding access together.
This podcast is produced by Outcomes Rocket, your healthcare exclusive digital marketing agency. Outcomes Rocket exists to help healthcare organizations like yours to maximize their impact and accelerate growth. Visit outcomesrocket.com or text us at 312-224-9945.